Hi everyone, here is Dr. Talani from Ontario School of Osteopathy and Alternative Medicine. Today I'm going to discuss about a very common topic that so many of the students ask me always in the workshops and in different classes. What is osteopathy? I'm just going to describe this branch of science. Osteopathy, as most of you know, is a type of manual therapy that try to focus on misalignments of the body and try to treat these misalignments with some sort of specific manipulative therapy, manipulative techniques. If you want to look at the word of osteopathy, osteopathy is formed of two pieces. The word osteo, as most health practitioners know, means bone, which we use this word in so many other combinations: osteoporosis, osteoarthritis, osteomyelitis. So the word osteo means bone, and the word path, which we have in the word pathology, also means damage or disease. Technically, the word osteopathy means bone damage or bone disease. But the reality is, the science of osteopathy doesn't really reflect this meaning. Osteopath, as the health practitioners who focus on this branch of science, they always looking for something, we call it somatic dysfunction. They're looking to find in the body, with all their diagnosis procedure, they try to find somatic dysfunction. What is somatic dysfunction? Because if you deal with osteopaths, you always hear this word. They always focus on somatic dysfunction as the diagnosis that they just try to find out. So the word somatic means body frame, body framework, or body structure. So the body framework is one unit of body, which could be the whole body or could be a part of body, let's say just the shoulder, just the elbow area, just the lower back area, which is formed of all the structures together, which is formed of bones, joints, and also muscles that connecting all the bones and joints together in that area, plus the ligaments that supporting those joints, plus the fascia that is covering those muscles, and also the blood vessels that bring in blood circulation to that area, plus the nerves that provide innervation for that area, and also lymphatic vessels that they just take out and empty all the lymph produced in that area. The combination of all these structures together is called somatic unit. Somatic dysfunction means if one part of body, which is combined of all these structures, is not aligned with other parts of the body. An osteopath's job is to do different types of diagnostic procedures to find out about somatic dysfunction. The moment an osteopath finds out about somatic dysfunction, then finds out about the root of this somatic dysfunction. Is this somatic dysfunction due to a muscle problem, due to a fascia problem, due to a joint and ligament problem? Is it due to the weakness of muscle? Based on the diagnosis that we find out in details, we can choose different manipulative techniques which help to treat that somatic dysfunction. So technically, after somatic dysfunction, we go to the next step. We call it OMT, which stands for Osteopathic Manipulative Techniques. But there is a big list of techniques we need to choose as an osteopath. It's all going back to the right diagnostic procedure, and we find out what is the source of somatic dysfunction, and then we pick the right manipulative technique, and then after we treat the somatic dysfunction, the whole body goes into alignment, and we're not going to see all those problems that client already came in with. So just very, very briefly, how this procedure is going to be completed. Somatic dysfunction, osteopaths, they use a procedure, the diagnostic procedure, to find out about somatic dysfunction, which they use an abbreviation, which we call it ARTS, or some other references, they call it as TARTS. ARTS stands for A. A is standing for asymmetry, and R stands for restricted range of motion, And then T stands for, there are three different meanings on this, for this T. The first one is the tissue texture of tissue. It's the tension of muscles, tension of tissue, and also tenderness. If we find some tender points on different tissues, that's also helping us to go to the right diagnosis of right somatic dysfunction. And S is a special test. We use some special tests to help us get into the right somatic dysfunction. So I just want to briefly talk about these four parts. The first part is asymmetry. So osteopaths, to find out about the right somatic dysfunction, first look at the whole body. They're just looking for any sort of asymmetry. We just usually use the same sort of a posture assessment that other health practitioners usually do. Like we just look at with the plumb line, we look at from the anterior view, we try to look for any detailed a misalignment, extra rotation of the internal rotation of the shoulder, for example, or protraction of shoulder or retraction of shoulder. If one shoulder is elevated or compared to the other one, if there is a tilt, any type of tilt in the hip from anterior view or from lateral view, we find out. So we just put all these asymmetric points by observation together that helps us to get to the right diagnosis of somatic dysfunction. We usually check the plumb line from anterior view, and then we check the plumb line from the posterior view. We check the plumb line from the lateral view on the right side, and then we do it on the left side. And we try to collect information to find out as more asymmetry as possible. When we finalize information about asymmetry, then we go to the next part, which is called range of motion. This range of motion could be like the range of motion of the whole body, looking the whole body movements together, which it reflects itself in a gait. We do the gait assessment. We ask the client to just go inside the room, just go a couple steps, and then comes back. And then we try to get some information about, again, mostly focus on asymmetries that we can see during the gait. Or we check the local range of motion. We check every single joint to see that if there is any restriction in the range of motion or not. When we find out the restriction, we have something we call it barrier concept. We try to find out what type of restriction is here. Is it matched with our barrier concept details? This will help us to find out about the source of somatic dysfunction. As I said, we need to know, is it because of the muscle problems, is it because of the bone problem, joint problem, ligament problem, fascia problem? Because as more detail we find out about this will help us to pick the right manipulative technique. Then we treat the somatic dysfunction. After going through restricted range of motion, we go to texture, tension, and tenderness. We usually perform this by something osteopaths call it layer by layer palpation. We do the palpation of body, specifically the areas that client has problem, or the areas previously we find out they have asymmetries or there is some restriction in the range of motion. With the palpation, with the right palpation, we can find out about if tissue texture is different compared to the normal texture it's supposed to be, or if one part muscles are tense compared to the other side, then that helps us that we know, oh, there are some tension here. Or if we find out there are some tension in myofascial layer, we know like, oh, there is the fascia is tight for whatever reason. It could be because of the previous trauma, because of previous surgery. So sometimes we just get interesting information here by palpation. For example, the example I usually use in the seminars, I say, client comes to me with the internal rotation of the right shoulder, and then I try to do the assessment. I already see this internal rotation compared to the other side. There is asymmetry here, and I'm assuming the muscles of the pectoralis area, they are into the contracture, and that is the cause of this internal rotation. But when I start to palpate this area, I see the muscles are not really tight. When I do further assessment and I do the palpation of the lower abdominal area, I see, wow, there is some tightness on the fascial level around the lower abdominal area. And when I just do further assessment and interview, I found a client had about 20 years ago surgery of appendicitis. And they just cut this area, because when they cut the lower abdominal area for the appendicitis surgery, they cut the skin, but right away they cut the fascia as well. So this fascia, the skin will be healed, and probably after 20 years you don't even see the scar tissue, but the scar tissue of that adhesion tissue of the fascia is still left there, and that causes a little bit shortening of fascia, and that pulling power is coming from the abdominal area will put your shoulder into a little bit internal rotation, and as long as you don't go through the proper palpation and you don't find out the fascia in the appendicitis area is tight, you would never be able to find out this condition. And you keep working on the muscles, chest muscles, but the reality, the source of problem is down there on the fascial level. So these are the ways that we do. So the palpation is really, really important, because that tells us like which layer of the body is the source of somatic dysfunction. Then again, it will help you to do the proper technique. In that example I told you, if I do the techniques focusing on relaxing the muscles, it's not really help the client. I just need to focus on the techniques that they're going to release myofascial. The fascia, the breakdown, the adhesion on the fascia, and the shoulder of the client will go back to normal. In osteopathy, we believe if this fascia causes internal rotation of the shoulder, this is not going to stop here. It causes other problems, probably in cervical area. Client might come to you because of the neck pain. When you check the asymmetries, you find out as an osteopath the shoulder, the right shoulder is internal rotation. And then you do further assessment, as I said, you find out the source of that is because of myofascial restriction in the lower abdominal area. When you treat this myofascia, the shoulder will go back to balance, somatic dysfunction will be released and will be in balance, and then the secondary problem, which is the cervical somatic dysfunction, will go back to balance as well, and problems of the client will be resolved. So this is the way osteopath, I just used it as an example that you see the way osteopaths look at the body and try to solve the problem. And then we find out about tenderness as well. When muscles are into hypertonicity, when the muscles are spastic and tight, usually there are some tender points are activated on these muscles, and these tender points also during palpation you can find out about them. And we have so many beautiful techniques that are able to release these tender points and helping osteopaths to resolve the somatic dysfunctions which are activating these tender points. So this is the way, and S is a special test, depends on which area of the body. We have some special tests, some of them are the same as orthopedic tests that we use them in other health practitioner, health practice branches, or some of them are neurologic tests, some of them are mixture of them. So we use these special tests that helping us to when we're not sure about somatic dysfunction or the source of a problem within somatic dysfunction, these special tests helping us to get to the right diagnosis. After we finish this procedure, after we did this, we get to the right somatic dysfunction diagnosis. As soon as we find out about proper somatic dysfunction, then we go to the next level, which is osteopathic manipulative techniques. Osteopathic manipulative techniques are the list of techniques that we have, and then we can easily, if we have a right diagnosis, we can apply them on the right place, and then the problem will be resolved. Some of the examples, like the famous one, I just want to make a list for you. If I want to say about OMT, the famous ones are soft tissue techniques, which are similar of these techniques. We have other health practitioners, such as massage therapists or chiropractors. They have some similar type of techniques, soft tissue techniques they do. We have, as I said, myofascial release techniques, that if you see the source of problem is myofascial techniques are very good to release that adhesion on the myofascial level. And then we can go deeper. If problem is related to muscle, we have some counter strain technique, which is the list of techniques that list of techniques that they are focusing on tender points, that they can try to release the tender points. We have FPR, or Facilitated Positional Release Technique, which again focuses on tender points and try to release the tender points. We have Muscle Energy Techniques, or MET. These are the list of techniques. Again, they try to treat the hypertonicity of muscles and also bring more blood flow towards the joints, which they have restriction. And then when you do the proper osteopathic manipulative technique, after the client with repeating the same techniques in the same session or within the couple sessions in the future, the problem somatic dysfunction will be resolved, and then the problems that client originally came in with is not going to be there anymore. I hope that this brief introduction explains what osteopathy is and what osteopaths doing, and I hope you enjoyed this video. Thank you.